Today, we want to call in a table waiting President Bio finally do yesterday na status. Yusuf go member say, since the start of the COVID-19 na salon, some healthcare workers them don't they complain for allowance and some other benefits them. And each time they complain, the government of Sierra Leone go promise them one thing after another. So yesterday, some being fulfilled. Now that we want to call in a table. We be done to blow the whistle, we be done to sound the alarm. Say, then people here, government forgive them waiting government promise them. So I think it's just right when governments don't give them, make we recognize then give them, and make we able make up of waiting exactly then give them, and waiting they inside the package for them. But before that, make we count the COVID-19 status update for today. 174 samples was analyzed. 174 samples now they analyzed. Out of the 174, 17 turn out for be positive. 17 positive cases. Remember, we can always say in this forum, more testing than we really need. Because whenever we get more tests done, for one reason or the other, the positive numbers can always high. Even yesterday, I be asked the question, we didn't say, oh, for the past week now, this and that. I say, well, let's do more testing and see low number of positive cases. But the 17 positive cases, now so it look like where we do them by district. Western Area Urban, 1. Bombali, 1. Koinadugu, 3. Falaba, 2. Kenema, 1. Kainlao, 9. Kainlao na then get the highest. Even Friton self, working the courts, picking big man in a one count today. But we'll find out say lately, the high numbers them always they come out from the provinces. Although they get high numbers them. So I think more work needs to be done. We know say the spokesperson for NACOVAC, when Solomon Jamiru is saying, now on upon himself no more night take not to forsake any feeling or nothing. But you say like people in the grumble say, hey, this test here is difficult because they give a chook swab right inside your nostrils and all this thing. So he not tell nobody. He just take upon himself and do them. And in test come out negative. So all and then they try for make people able for say in necessary for make them safe voluntarily take COVID-19 test. We are free if you know the travel. You voluntarily all now we need travel. But as long as you get for travel, you go pay for them. Okay, now so the other numbers them look like for today. The confirmed cases now na salon do reach 1,803. 1,803. The one the Modena Isolation Center now 381. 381. The one them we don't recover from COVID-19 for the past 24 hours, now 19. 19 people don't recover from COVID-19 for the past 24 hours. We don't carry the total number to 1,355. 1,355 people don't recover from COVID-19 in Salone. One person, when I 71 years of age male, lost in life to COVID-19 in a 34 hospital within the last 24 hours. One person, 71 years of age male, lost in life to COVID-19 at 34 hospital within the past 24 hours. We pray, say, in soul, go rest in peace. Whether one they don't carry the number of death now to COVID-19 as alone to 67. 67 people them not lost in life to COVID-19 Nasalone. In quarantine, na 505. The one them wait on the inside quarantine again, wait on discharge, na 9,397. 9,397. The big idea for the week still stand. We say while we fly high, we still want for keep the positive cases them low na Salone. Now the big idea for the week. Because we know say every week, Nakovac get written and call the big idea. What's in again they need for do? Or you think say they don't do all what they need for do? It's just left to Sierra Leoneans for adhere. What else? You think say Nakovac need for do? For make Salone go test boku people them, but still yet gets low number of positive cases. Like as I've been saying earlier at the start of the program, for say President Bio, be don't talk say he want to do this, he want to do that for the healthcare workers in a Salone. The healthcare workers them don't they grumble say all waiting them promise them they need to give them. Then go to the extent say then they ask the head of Nakovac, retired Brigadier Kelly Conte, for say he need for can publicly for can apologize because he tell them say some of them they inside this business for the wrong reason. Healthcare workers them then they for make money because they know they for serve humanity. So then we get chamot with the head of Nakovac. And we hear when the Minister of Finance be go na Parliament, where Parliament tell and say, what's in the happen with the healthcare workers the money? Because the allowance, they still a grumble. What's in the be reply to them? He say money not to the problem. Money not to the problem. Yes, that's what he said. He say money not to the problem. He say na administrative structure na the issue dey. And not to the first time, the Minister of Finance they say money not to problem. Now I make I always tell people and I working can say, oh, this government no get money. I want in a bit trade with them can. Now they tell you say then meet a broken economy. You hear them they talk. Then they talk again. Right now, money not a problem for them. If not buy trust now, if not buy give now, but then get money. So he tell Parliament, he say money not a problem for pay them. He said then they pay the healthcare workers, so waiting an allowance. He said allowance that nothing. I ain't quick for talk dandy. Now ya back if you don't say then say, oh now they bloat the economy, oh now they hire people, what he say? He said waiting on $6,000. He said $6,000 nothing to the economy of Sierra Leone. Yes. All this one, then they on record. He said it. So now I make people think, well, this government no get money. There, the one that we did it now, not tell you say they no get money now. But however, him tell Parliament say, he say na administrative issues. I mean they not be able to pay them. Who self na ya will be called say do ya. The one the moon I get question mark with. The one the moon I deal with, but the one the moon I feel so no get question mark with. Una pay there. So after all back and forth, well yesterday, and we did a status for make them honor waiting them be promise. When the body will command them, the healthcare workers them be the grumble at salon, alia. Waiting Nakovac be tell we. Now, the Minister of Finance they tell we say, anything we get for do with money grumble, people and they accuse the number for nothing. Because waiting do, na Nakovac, na then can get the issue. You see, I seen the talk so right now. Nakovac get 20 billion loans na their account, and Nakovac still a call for more money. 20 billion, then get another account, don't then they call for more money. Is tell we back say, then don't spend over 130 billion. When a government na don't spend that. It say government na the highest spender by this particular threat against COVID-19. I know say the first way can I imagine you begin to say, okay, where all the money there? Where WHO, World Bank, them money then they give, where them money then they. I hope say they don't account they don't touch there. Because he say 80% of money we don't spend. Na government of Sierra Leone and na their money. Compared to waiting. The Ebola. The Ebola boy, who can't take the donation, there will be the kinds of who tire for count. I go and not go well. Commission of Inquiry began for tell we. So if in they tell we all waiting they tell we so right now. Then if we go back, who don't know they talk to Gunaya? Because at that time, I remember the question where everybody be they ask, who should take responsibility? Who? And that's the particular word way Lamana of AYV can always ask Nanakovac say, who therefore take responsibility of this? Because always when the healthcare workers then grumble, not to they a doctor go sit down one old day and no agree get money. Now they Vicky Rimo out of his C90 project go pay, not to be I think I'll be 10 million leons. But now they tell we say, not them no the way Nakovac no get money in their account. He say right now, they get 20 billion. And they still call for more money. Nakovac, they call for more money for make it in their account. Even though they get 20 billion, no. Not to miss you. Na JJ Safana, the minister, na him say. So, the money we IMF or World Bank or they give, we hope say they not touch her. Since that then, they don't spend 80% by the fight against COVID-19 na salon. They don't spend 80%, which means the government of Sierra Leone. So that one way, then can always tell we say, oh, no to them, na system and all those things. And then they will all land today. But make we hear waiting Usman Toli get for we na the program today. Yes, Usman Toli, you get the platform, sir.
Okay, Triple A, first of all, thank you for bringing me to this program today. But I just want to make one thing clear. This is not the first time we bring this topic in this forum. We only discuss them. And most of them here we will discuss, so not to muting them. Quickly, we will talk about the healthcare will command and benefit them. I'll just give you a summary of the benefits them where the government don't pledge for give the well body will command them. First of all, to start with, the government, they sign a Memorandum of Understanding, MOU, with the frontline will command them. Because where this COVID-19 started, we been get a shortage of well-body workman them. Because then they think, say, in the past, especially during the Ebola, the way how they treat them, they not been treat them well. So boku workman them been afraid where this COVID-19 start. So in order for motivate the workmaya, then go into a kind of memorandum of understanding, MOU, with the government. And the promises them where they make to the workmaya, one, I want to get this quite clear. One of the benefits them, they say, then they exempt them from that tax. That is to say, the tax where they're supposed to pay for 3 months, and they keep on for them and give them. And then they will remember JJ Safa being come out publicly. He said he don't pay them that money for 2 months. They don't pay about 8,889 healthcare workman them. That money he said they don't pay for 2 months. That tax exemption. That's one of the benefits them. And secondly, we talk about the allowance, when are the wage, the salary. They say that they give them 1 million Leone every week. Every week and for give them 1 million Leones. Then they pay them. That's one of the benefits. Members say the government may say, the United Nations, they say that they give them 500,000. Yeah? But government not just, they say that they may come to 1 million. So now 1 million, they say they will pay them weekly to let them motivate them, to let them do their work. And the other benefits were very important, were the life insurance policy, where a lot of workmen are not been only enjoy. The healthcare workers are not been enjoying in that country. Now that life insurance policy. And what's in this life insurance policy? You listen clearly to His Excellency the President. Yeah? Julius Maada Bio. Yeah? In talk say, anybody will die of COVID-19, the government they give they pay for in picking them up to undergraduate level, 1st degree, 3 of in picking them. Then I one. Secondly, it say anybody who is sick as a result of COVID-19, they get 55% of in salary. Yeah, they get 55% of in gross annual salary. Yeah, if you're sick, for make it treat himself from COVID-19. Yeah, because of the expenses where they get from that treatment day. Then now the other benefit that one day. Yeah, and the other one also where they get something for do with the payments and when they get when you die. You know, they receive 2 years of insured gross salary. Yeah, they receive 2 years of insured gross salary. That back not benefit where you next of kin you receive from the government. So now all the benefits here, now they don't put inside the package. Just for help them forget the gist of what's in this insurance, this healthcare insurance when they talk about. Now let's speak to the issues then. Well, it's very important for note say this is very motivational on the side of the government. Because if you think about what may happen during the Ebola crisis, we see over almost healthcare workers then die during the 10 day, and most of them will not be able to enjoy the benefits that they're supposed to get. Over 90 people die, healthcare workers die during the Ebola crisis, and a good number of them not be able to enjoy the benefits that they receive today. Yeah? Now make where COVID-19 kick in, we may get problem. A lot of them are afraid for report for work. Until when they sign this memorandum of understanding, I think I motivate people and for come forward for undertake the work. So it's so very important. It motivational. It motivate them to come into the job. So we will say kudos to the government. Yeah. And the other good thing also, you see, we don't see clearly a display of integrity from the president, because we see where he launched the life insurance scheme, and inside that life insurance scheme, he gave a present a check to some of the people that were known for victims of COVID-19. And I see the check. I think on the check there, one person, I think 257 million leones, 257 million leones as benefit for one person. Yeah. So those are good things. But the things that were actually surprised me, and I think this only happen over and over with this government, and I think we only talk about this over and over, is this issue of lack of coordination, collaboration, and integrity, if you like. Yeah? Dishonesty, if you like. Because for too long, we only talk, the government say the money day. But the problem we then get, they say, now verification. In other words, some people are waiting to be employed. Now during this COVID-19, the healthcare workers, who command them, where they employ, they get to verify them. Some of them not been getting code, so as a result, they get to try to verify them, to make sure, say, the payments where they give them, they go through the accounting procedures. So then they say, and they take time to let them pay them. Yeah? And as you say, AAA, I can listen to NACOVAC. Yeah, and I saw them in television. They say they need verification. Today, we don't listen to Cheques from this audio we don't listen to. He said not for money not the issue. He said that as it stands, he said NACOVAC gets over 20 billion loans in their account. So not to them be the problem. And 20 billion leons is about $2 million. Yeah? And you hear how the money brag. He say the wage bill is about 250 billion leons for pay the staff then as alone. So what's in this amount of money? But again, we know, healthcare workers and only complain about their salary. Today, as I talk to Naso, before this program they start, I talked to one brother where they work na the healthcare center. He said they not pay them for 2 months now. Yeah? And here is this man, he can't talk, see, he don't pay money na NACOVAC the account. So not to them get the problem. It's about, he said, it's up to NACOVAC how they want to spend the money. So not to then get the problem. So the question where I want to ask is, who are they for blame for this lack of we will say dishonesty and lack of integrity? Because they come at one time and they tell you this, the other time other person they come and they tell you another story. So there is that lack of coordination and collaboration, especially among the various ministries then. Especially in terms of the various ministry. So the greatest concern is if money day, as we say, why is it that the healthcare will command them when are very important people then towards the fight, towards the COVID-19 fight? Why? Why are they not for pay them? This is not the question we try for ask. It's good. We don't make all them fine promises here. And we know what it entails for them at the front line to fight against COVID-19. We know there's a lot of risk involved. So if you don't make the pledges, which is good, the benefits there, nobody not force you. Even when they say 500,000, you say 1 million, and then you don't bring all that benefits here. So what's in the problem now? You say money day. This is why we ask, is it something to do with the systems? We ask with the ministry, is it the systems that are in place? Is it because the care workers and caregivers they don't get bank account? We are not able to devise a method by which we are able to pay them people here in an effective way. Is it something to do with what are the reasons why we are not for pay them people here on time? Why? This is not the question we will continue for us. And AAA is important for let us use this as an opportunity, because we know one of the problems we're going to that country today, a good number of the people in that country today, first they don't get bank accounts. They don't get bank accounts. Yeah? So why not use them here as an opportunity for encourage people for open bank accounts? Yeah, create a kind of system where people then they work with the bank for make sure say them people are now registered workers them for make them open or let them give them way for let them open account. If not, that's not the problem. Or use tell money, orange money, or official and all that thing for try for find way where they will pay them people here. If not, that's not the problem. Because as it stands, from what he say clearly, the Minister of Finance, Cheques, he said not all money not the problem. And there's something wrong. It has to be with the system. Because it don't go on for, imagine this don't go on for almost 3 months. And the MOU with them is signed for, now for 3 months. It starts April, it will finish June. And this is not July with it. We don't know now whether or them, because let me say it's subject to review. Maybe they don't extend the time of the MOU. We don't know. But it's been going on for too long. This for not resolved by now. This should have been resolved. And this man, they talk big. Talk big talk then. And ignoring the fact, say, the more big talk it talk, the more it damage the credibility of their operations then. Because if you say money day, yeah, and then they try for shift the blame to NACOVAC, and they want NACOVAC open their mouth and talk, what's in the talk is different. This is not the problem. There is always an issue of collaboration and coordination. Yeah? NACOVAC, they tell me, say, it's something to do with verification. And when you talk to the Minister of Finance, what they tell me is different. It's just blaming each other. I mean, it's good that the government don't begin meet some of the commitment then, yeah, by launching the national insurance scheme for the healthcare workmen then, and they don't begin payout, which is good, and I commend the government for that. But having said that, it's important when they call on the government, but let them try to solve this issue once and for all. Because sometimes they do 10 good, when they do one bad thing, when I read a bad thing, then they forget about all that 10 good they don't do. It's as simple as that. So now that number one say thank you very much for it. But also the first thing is when they bring this thing at that table. And also most people understand what whole thing they're about. It's just lack of coordination and collaboration among the various parties that we're concerned. Thank you very much, AAA. Thank you.
Thank you very much, Usman Toli. Thank you for your time, sir.
Yeah.
Okay. Make a count, Aisatu. Make we waiting you get for it today. Yes, Dr. Aisatu Kake Jalo, waiting you get for it today, ma.
You do well, and we want to say thank you to the administration for this life insurance policy that they don't put in place. But they've done well, and we person do something right, you tell them thank you. But where there's issues with it, you need to point them out. So I believe saying I did the program there with me right now. First, I want to start by saying that the life insurance policy everybody know, now only way they're around, then can utilize them, which was clearly noted by the president in his speech. But the downfall with this is nobody no one for die in the process of something we will not say yes, it kill. That's COVID-19. And while you're at the process, you still, the government or the administration will still pay you for your salary, or the allowance where they don't allocate, say, then will give healthcare workers during the fight against COVID-19, because of, it's supposed to be like a hazard pay, because now then they risk their life to go out there. And the back and forth and the statements what they get from the Ministry of Finance, in statements, don't make payments, where they say technically we don't even know what's going on in terms of that. That's something they need to try to clarify and see what's the problem, what's the system where they call this area for like healthcare workers and go out there and say they not pay them. I'm sure they get better things to do, which is to take care of the patients then, rather than for go begin to ask them for their money. If you don't sign something, a contract or memorandum of understanding, say, now this I will do for you. Go ahead and do that. If you still say now data, then not the problem because they don't get bank accounts. Tell them, say, well, you need bank account. Just like Usman Tolibi mentioned, open a bank account, encourage them for do that, encourage them for do something that they say, then we get the money faster than, you begin to say, I don't pay to this account, or they wait for list for verify. It makes no sense because when you hire somebody, the day when you hire them, I'm sure you get all in credentials. You ask them for all in credentials. It submit everything to you. It don't submit them to you. Now it's time for you to let you disburse this money also to them because then they do their job. But no, yes, it has to be a fist fight. Like you have to go back and forth, back and forth. What is that going to do? It's not going to help. It just take time from the healthcare workers, them, what they're supposed to do for them patients. Now, valuable time than that day, and a stressful situation, and as we know, what is stress to do to human beings. So really, we really want to let them strengthen, the data system, the way they had them one for pay the healthcare workers them, for a short say, people then could sign up for accounts, if not that's not it, which I'm sure not the fastest way. You see every side and they encourage you for like do a direct deposit. Because that direct deposit, it is save the company money because then checks that when they print, it costs money. So you save money. So they save, we talk about, saving the trees and all these things. Those are papers and they're made of those kind of natural resources. So Lord, think about that and Lord, try to utilize that, very well. And then what would we talk about, caring for the children, up to undergrad, that's the first 4 years of college, that's good. But I don't feel safe. Therefore, put a number to that, how many picking the person gets. So you want to tell me what the person gets 4 picking. In 4th child, it doesn't deserve to go to school. It don't make sense. So for me, example, I have 3, but each time I have 1 kid, I call my union, they add that child to all my benefits that I have. Same goes to the HR department, so, and I update every beneficiary, anything I get. So they're not they ever tell me, see, because you don't want more than 1 or 2 or 3, people know they're passed down there. Now this America, they get people with 7, 8 beginner. But I stop them for getting health insurance or getting, cover them under them parents, them benefits. I think that's not something where they need to go back and revise. That limitation, that needs to go away. I don't feel any parent need to fulfill that worry now. Oh, you're not the first picking, you're not the second one, you're not the third one. So guess what? If I know this insurance will cover the small one. It's unfair. Nobody want to feel like that. So that's something they need to fix. And then goes to the number of years where somebody don't practice, where you don't work for a government for matter in how this life insurance, or some of the benefits that they offer to the deceased when that do happen, with the hope that doesn't happen, because really, I'd rather have my parents than, have to deal with, things like that. right? So if the person don't serve more than 10 years, in coverage for say, okay, you don't serve more than 10 years at this institution or at this government place, so you cover for life, right? Let me, I can always talk now, I did work for a government when at the city of New York, rather than working for private. Private, you see your money up front. But these government places, whether it's federal, state, or city, your benefits is what keeps you working there, right? So, like the union when we get, New York State Nurses Association, then once you're done with 10 years, you signed up for pension. Your pension is now done. You're covered. As soon as you retire there, you get full coverage. And that's your health insurance. So I'm not comparing the U.S. with Africa. But why do we compare U.S. to Africa sometimes? Because that's what we want for Africa. It's a continent that needs that voice to be said all the time to our politicians to understand that. You travel overseas, you see good things, you implement them in your country. So let's not confuse that. We know we don't expect things to turn over overnight. That is true. It takes time. But you know what? As you do them, make sure you put structures in place. As you put these structures in place, and I'm sure it will help in how the future will look like for the next generations to come. As AAA, they always ask, the salon will get today. The salon will then be done left for we. When I this we want left for we, to them, no, I don't think so. We want something better. Because you went through something doesn't mean your children have to go through that. You lay that foundation for them, right? So that's now in terms of the topic for today. But AAA, I really want to touch on this medication where they go on social media. For we listeners, for we viewers, for the one who they watching on Facebook, we don't talk about this. And I'm sure the reason why we still say hydroxychloroquine or chloroquine, not a treatment for COVID-19, right? So just this abstract, it came out from the College of Cardiology. Okay, this is not they deal with heart. Say, the Scientific Medical Policy Committee at the American Colleges of Physicians recommends that we should not, okay, the word is bold, not use chloroquine or hydroxychloroquine alone or in combination with azithromycin as a prophylaxis against COVID-19. They went on further and said it should not be used to treat patients with COVID-19 due to known harms and no available evidence, right, to benefit patients with COVID-19. And we don't talk about this. Hydroxychloroquine, there's so many side effects there, where they say they cause cardiac complications. It's not only, even if you don't get underlying cardiac problem, it is trigger that. So no, they promote this. Because it not only damage your heart, it damage your kidney, it damage your liver. And this week was World Hepatitis. They try for a lot of them get tested, get screened, and things like that. Right? You need your liver. Your liver, they do so many things for your body. They detoxify medication, food, and many others. Same goes to your heart. You need your heart to pump blood to your vital organs. So law not to promote hydroxychloroquine. And the same goes for azithromycin and antibiotics. It's okay to use azithromycin because in the treat the pneumonia aspect of COVID-19. And it's okay for use vitamin C, where would they get from foods, vegetables, whether not green vegetables, different vegetables and where they get vitamin C from. Sometimes if you feel you don't get adequate amount of vitamin C, it can encourage you to take about 60 to 90 milligrams to the maximum dose of 2,000 milligrams. But if you take too much of vitamin C, it can lead to some side effects. So there you get to watch that, right? So And in not wrong for take paracetamol or Tylenol because you get pain, little aches, as long as you know the dose limit. So if we understand, say, there are benefits to every medication, and also there's a risk factor as well as contraindications, meaning you're not supposed to take it. And that's where you don't take hydroxychloroquine. It does not only affect your heart, I would emphasize this, it affects your kidneys, your liver, skin. It causes many other side effects. So please, I don't know who wants to promote this, but think about it. You need your heart to pump blood. Because if you don't have blood in the tissue, then guess what? It's like, your tissue is going to die. So vitamin C is there to help protect your cells. It keeps your cells healthy and try to maintain your skin, your blood vessels, your bone, your cartilage, and wound healing. Down there functions them when I benefiting them rather than things that causes you problems. And eventually you can die if you don't survive it, right? So for that reason, I want to let an answer.
I still want to hold you small. You can just make it short, because the argument is, after this video go viral, people then begin to talk the same thing. I know say this is not the first time we're talking about this chloroquine at this forum. People then begin to say now too, we don't take him for more small will not die. Yes, he can make with scratch no more, or he make with this, he make with that. But at least now we they so delicate today. So why if you say now if we take him, we go can't die?
Because the research, right? So most of the time, as we don't see now, so when they do a clinical trials, like for any medication, then you start with the phase 1, 2, 3, and then you can go to 4, and then the phase 4, where they say they don't approve the drug out of phase 3. When now many people then they take the drug, but while people then they take the drug, they can get the Food and Drug Administration, like here in the U.S., gets a hotline where this is if you experience any side effect with a medication, you need to report them. So as then they report the side effect, then they see the number of people that will get the side effects or the complications of them, and also sometimes healthcare workers themselves can report them. And sometimes I can write prescription, I can get, if like a patient reports, they reduce the dose because, the platelet count was low because I didn't work in oncology, then can send me a paper. Waiting at the corrective action where I take for make sure the patient, the dose where they initially get, it was appropriate, and waiting at the thing I do going forward. Right? So we serve the healthcare workers and we're responsible for report adverse drug events. Adverse drug events different from side effects. Side effects, when you take your prescription, it clearly say what are some of the side effects that we will expect, what are some of the things that we need to tell you doctor if it persists. But adverse drug events are things that we know they expect it will happen with the drug. Right? So that's the reason. And then as they look at the data, the FDA can pull that drug out of the market, right? If you recall recently, maybe like almost 2 years now, Zantac, what did it take for heart problem, right? I mean, like heartburn and things like that. It was recalled. Why it was recalled? They find out that there is a carcinogenic agent within the drug. So that can happen with any medication we don't do out there for years. So that's now one thing people have to understand. And even, like there's contraindication for the malaria. There are types of malaria you don't use hydroxychloroquine or chloroquine for. So because, at least I don't want to keep going, we can talk about hydroxychloroquine, a whole program if we need it. But right now, I think I debunk that.
All right, thank you very much, Dr. Aissatou Kake Jalo. Thank you, ma'am.
Thank you.
All right. Make a call to us friend. Make we hear waiting us friend gets for we today. Yes, us friend, you get a platform.
Yeah, good evening, AAA. Thanks to the previous analyst. What do you want for just take into this insurance scheme where then you just don't try for launch and try for pass on? Waiting at CBN, a good move in practice, And then even in principle, if you don't say them, now you don't put it in practice. Because if you don't say them, say you go do this, but the delays them, we don't be behind other necessary things that they're supposed to do, would they not be able to do at an initial stage because of either coordination, as Mantori say, then get divisions of the NACOVAC, then get the one who are the presidential tax, who they give money. They don't give money now, they don't give NACOVAC this particular money. But even this money, we are suspect, say, we in the Jusu, they talk, say, they don't give so. I believe, say, that the Deputy Finance Minister, one, when they say that we don't take as a new person for the NACOVAC team, for coordinate between the presidential task force and the NACOVAC team where Jamiru then the head. If they get forget delay in the money for come to the final person who for receive the money or the areas that would need for disburse the money, it would be say another deputy way na the deputy finance one from waiting at the see if at all it is say that $2 million day na the coffers of the NACOVAC. But with the people I don't know that the NACOVAC or the presidential task force is hand between or it really day inside the hands of the very NACOVAC team where they move around up and down. Because anytime they ask them and go see they don't know. Or this go say, okay, we don't talk to this and a person we good, he ready for can't disburse the money. Because the last time we didn't go to carry now. Because if you don't go to police, the whole body hottest place where ever get a confrontation, a carrying a been watched that and briefing. I think the people of Kenya they be absolutely disgruntled. Everybody they come. Say at some point they get for say, well, would they go meet get for even in the Jamiru get for make a phone call, which was may not be look official, but inside the briefing. They say, well, I call, but somebody not be pick up the phone. Just for try clear in your own side, but oh well, not to be fall to the false date to somebody who responsible for disburse this money. So it comes to delegation of duties for the either they give in your duty, in do am or in no do am. Or they get person where they able for prompt say that you responsible for this, but at the beginning of the setup, now the problem began there. But now they see that they surface some of those things they are like giving out the money to people that wouldn't suffer because of or they don't succumb to the virus, they die or they sick, because they get different food insurance. If you sick, that's a thing when they give certain amount, and then if you discharge, you come back, they give certain amount, then if you finally die, anyone would they give now one about this 200 and something million leones would they give to a family and the next of king. And they include 3. If you get 3 picking them, 5, then at the first 3 then will look after at the certain stage. But you look say now the coordination still I hope say then go able to try see what they go do behind them. But the coordination not can fall behind say who are responsible for giving money. Would they give now then they give a budget or they give like something to say like an estimate that this now we expenditure. Now this we need. Look at the amount this. Or then get different ways to look and say, well, will they look into just the transport, the petrol, and things and other things what would they do? In terms of the salary now, we left out to the presidential task force, or the bridge between the task force and we. So now that can always they confuse people. And after every time they ask the question, then they ask them the question. There's not going to try to make moves here. We are tired of this question. Now this structure we want. Because we don't know when this COVID will go. We don't know when it will cut down. We don't know if this second wave will come. People are going for the big on a salon. They come up from all areas. We don't know who's strategies they get to put in place. Apart from the one that will open the airport for the time when I interim. For long term, for say, in case we can get a zero of no more cases. We people get for good for the one that we get for the camp. We don't know who's when they come on, we don't know who's type in now and day. The person is not going to show symptoms while it just arrived. It's not going to even show positive. Maybe the virus still incubate. As it don't enter, then the virus don't burst open after 14 days. So it's impossible to cross all those lines. So what are they putting in place for the medical areas then? People look at the vital things to get put. this is important for people who will die and give their own money, which is fine. That's one thing in the to-dos. What about the to-do long-lasting? That is now a 50, then therefore try to look into them, establish a good coordination where the one that would call whatever and tell them government, presidential tax also, or the one that would have committee or wouldn't have this, so let them go able to a long-lasting legacy of some people and structure and some people who left. When they go say that during the COVID time, that they this year get for this now, when they look and they go. This all won't come immediately, so it's very good. Anybody family, they are not long lasting, who will benefit everybody. You know the prayer person die, you know the fee say back, you know the hand who don't die wrong. So they look, say let them look and the other again say, talk about the populace, what's up for the live day by day. Because if you look at the percentage of health workers, the ratio of them, in they always talk in the Jamaican that statistics. Well, now the statistics of how many doctors for be to the population of certain people, how many nurses to be to the population of certain people. Are they thinking of trying to help those who not get that pin or recruitment to try to bring them in the system? Not for now, but it should be any other thing come through, or even for the ongoing system, like you get hepatitis B. What they have people, what they cause a lot of problems, like HIV, you get all that disease as well. How can go for combat this? Or whose package will put for maintain this? We will only have whether WHO we can't give it, or we only look for the UNFPA, because that area of hepatitis, when you look at people are still paying money for that, for even go test. Test they say at 20,000 euros. It's small, but not small for some people. And when you don't do the test, if you're positive, you got to go pay about 70,000 euros. Some other area there'll be 200,000 for that hepatitis. And at 3 doses you have to get before the final, before they left you say you don't full. And they give the first one, they get a gap between certain months. You go for the second one, then they give the final one with the booster now where you go with. So if they say the people they get for pay for all this, well, and then they advertise them and then launch, and like yesterday, and then launch that one day back for saying now World Hepatitis Day. All the mainstream media have been there on yesterday. Some of them been doing on Zoom. All about it. Tell them bring the other pharmacists to or something, Gawazi, something. Now pharmacist. It's like for say, well, it's cheaper, small. But even then, you look, say these are the things all government get for they put in place and they plan. I don't know if they have them behind the curtains. We don't know what they do. Because some of them things I just see them when they come out. One thing, they say that this we don't do. But that is what they have to be thinking about. Long-lasting policies we go able for it, then we implement for let the people at the health service go able for structure. This na consumable something. The money they give a consumable something, it go done at some point, the person no investor. But if they plan, they put building, the building it go only need for refurbish. They buy a material, it go only need for repair. So all of those things, they have to prioritize them. We're looking at the insurance, I still they say it is a very good idea, even though it don't come at a late time, because listen, some of the doctors, they who don't die, they fambule they give. Or we would ask a question back, say, is it because of some of them, they have influence for one or two ways, they are the reason why they fast track this? We can't say that, because they don't say that before this. But being it fast track, as compared to the salaries then, when they're not still fast track, they still get hiccups in salary, we will think. Because the other disease, I think, say, if fiancé is somebody from another foreign country, with the children who are based in Sierra Leone. I can't go in detail to that, but I'm just saying, is it because of influence who some people can get, or now because of actually what they mean for say, then they do them. So my only hope say, they will think about this as then the structure, wherein Safano will just become for candidate this the amount of money, because he's calling big amount. He's never giving us what we need to know. He's only telling us things that are there, that they are meant to be, they're meant to be there. But where are they? People don't see them. They only hear about them. So I only hope say they will think, say some of them things that they become visible to the people. Where if Nakova will say this, now 100,000 will spend, like one thing will be asked, they say, when they get a household expenditure of somebody, would not be feeding or this and that. That question was not directly answered. It was answered indirectly. So all of those things, I didn't get for the team. If then they get a budget, we'll go for trying to work. So when I get budget, or so far, so good. Almost when I don't say all these things are averagely when I spend inside the month of the past 3 months now from March. Almost when I say March begin now, April begin now, May begin now, June begin now, and now we are finishing July. So that might give them a picture for say, well, how we go before. So that one of feel say then we're able to consider. But apart from that, the idea of the insurance, it is very good, but let it be a double effect. And let us think about the epidemiological way where they will look at then at the way of the behavioral pattern of the virus. They will cut them if they know the virus in pattern. As they understand the virus in pattern, even though in a novel one, but then they go with the basics, the way they get from their own way where they look at the virus and their own studies and their own data where they collect, and based on the guidance of WHO, then we're able to deal with this here. In case other things can't left now, we will know how to deal with them. Then put on a table. So anybody who can say that this strategy will be applied. So it will be very easy. Other than they just do surface no more. Tomorrow now other pattern will come. So the pattern is not flowing. And one day in school, as they say, the day in school does not make a scala. Because now like when they say a catalog of events. Now continuous day, when I'm systematic, every day you go say class 1, class 2, till up to a level. Then you don't make a scala. The scala don't come from or that the information don't come. So now that one they flow. Not when they can't see this, they can't do this. Well, I'm going to address this. So you will find out that they will become a bit not focusing. And that I've been telling them they are una get something for maintain una mental state. But then if you don't say mental, some of them they know actually, but some of them I think, oh well, mental state like somebody don't go off or it is bad. No, the stress sometimes they see and find them. That is part of the mental state. So for avoid all those pressure, they have to put things in place. Who will lead them, who will lead to that stage day. But the more they add up problem, one day you see them and come in one mood, they are laughing like today, we are all happy. And then tomorrow you will see somebody they talk. Well, you will see say there is a bit of stress. Because then they ask a question, what you mean? Even give out, if I let go stress, I see 2 days ago, when you be asking that question regarding people that travel, what did he say? He said that the expenditure, now you choose for travel. When you come over, now you choose for travel, and now you plan for travel. So anything we get for undergoes, that is the way he answer you, which was not what you wanted. You wanted to know if the people that when they come, then they go, then they go pay for a hotel, or then they go na this. But he answered them in a way where it fits in your way. He brings the answer really, but in a surface way where you experience it for see. So these are all the areas I get for see no more. Let them try. Then let them try put things before to them. Say, oh, now this will be so. If we not do this, well, we can't sit down with it. Let us go on a river. Let us see what they face. It might be of help. Let God continue for help with. Thank you very much for giving the platform.
Thank you very much, Usfriend. Thank you, sir.
Yeah. Thank you. Welcome, sir.
Yeah. That's our Usfriend, submission for the day. I can always talk and I say, sometimes I tell you, for even ask question during the daily press briefing, because when you ask one thing, who side in the drag you go, I don't know if due to say they don't understand or due to waiting they can don't make up their mind, but something can always not correct. Just like how Usfriend says. Now, question I just asked, because we all get another big idea of the week, and say waiting, then go carry you go na isolation center. But before, waiting civil aviation then go carry you go na hotel, you go pay for the hotel. So I ask, so which is which? And just like how you see Usfriend answer, that was the answer where I get. And not true. Something they can so glad everybody can happy for come on, and some other times you dare not ask question. Even though they ask you, yes, who don't want for ask question, who don't want for ask, but not guy more. Because, man, I know say, not so easy job. Really, really not so easy job. And we all can tell. Because, for say, a pandemic is on now, and you get this tax for updates the people, not easy, but again, that's the job we then call for. And somebody has to do it, and then they don't choose. So I guess they have to just man up to the job and give you the answer we need. Make a call to Tony. Make we hear waiting he gets for you. Yes, Tony, you get a platform.
Yeah, Abraham, good evening. Good day, everybody. Good morning, wherever you do listen. I will start with Dr. Esatu, now a few questions I'm going to ask. And I happen for the Oakland Hospital. And once where I don't learn, or where I don't know, even where I'm disabled, all medication, the side effects. All. Even inside in all what they take. Like, when we get kidney issue, there are certain medicine that they want to take. Because I know say, it's not good for me kidney, especially some of we don't get it threatening things steady. So my question where I want for ask is, the medicine way that woman, the softballs, you understand, where we they take? I just want a clarification because like there are certain medication we they take, we get side effects. You get certain other medication we will take for limit the effects, making it go be too much, let it go give you adverse effects, it go make you whatever. So medication they go make you dizzy. You understand? So medication will go make, so I'm just, not the online or probably one later.
So what's another question?
The question is, inside some of the medication, they get effects, like the one with
they talk about chloroquine now.
Chloroquine, you understand?
Mm-hmm.
Most of the medication, chloroquine, the reason why I feel say, I'm going to ask some question, waiting at the side effects of chloroquine.
Okay, just hold on. They make an answer you because Judge Kamara be don't answer. No say Dr. Isatu back be don't answer. But this time waiting Judge Kamara say. Judge Kamara say, he say chloroquine, he say COVID itself, they cause cardiac complication.
Mm-hmm.
Then the medication, when a chloroquine, it gets inside effect we get for do with cardiac complication back.
Mm-hmm.
So you don't understand. So if COVID-19 inside effect na cardiac complication or one point affect them na in causes them na cardiac complication, then the side effect of chloroquine the same thing like waiting that one day. So you just add no more now by the cardiac complication.
Okay.
So now I make them the advice say not take that day because in your side effect now the cause already of COVID-19.
Okay, but in the say there's another medication you can take with chloroquine or whatever.
No, not say for take chloroquine.
No, what I mean, this lady that Cameroonian lady with school in Nigeria, and they say that doctor. But actually, not to that area they will talk about. I mean, just want for ask questions more for make her know because the lady they say 300 and still counting and no death in her record. It left to the way, verify that if that's not true and all. But basically, as I say, that's what they discuss. And the other area I want to say quick one where I want to talk about. Now we are in Usman Toli don't they raise that issue, Mr. don't they raise that issue the way if you listen to the Minister of Finance, they tell you say money they and they do their own parts. It's like division of labor. Every ministry gets your own parts we get for play. Ministry of Finance not to get for pay, they staff them. Basically, their role is to just transfer funds to the ministry or NACOVAC or wherever way necessary for letting transfer funds for the fight. I feel say the problem where we don't mention here is systems and processes. And what are the systems and processes now wherein they do the transfer, which is debits the account of NACOVAC or Ministry of Finance. They're left now with the task now out there for expedite payments. Now they the bottleneck situation day. We all wait on this Sierra Leone, wait on the go Sierra Leone. Say salon, 1 green paper or documentation where you try forget. Then go so make and like I say, documents where you go pay for an year. Or where you go pay outside proper system, the way you go take 1 week, they'll tell you 7 to 10 days you go get them. Salon and go tell you 1 month, 2 months before you get them, because many times people know they do their jobs. You understand? At times they have the processes. They actually have a very good processes. But the priority in people delivering or doing their jobs is where the problem is. If you get the urgency where in finance you get a supervisor or a manager managing that unit where not to excuse the results they want, every morning they need to update that data. They need to update that information. Where you pass NACOVAC, they pass on to the Ministry of Health or whoever where they make payments. You understand? Because basically they will tell you, oh, we were verifying, we were doing this, we are doing that. Verifying doesn't mean you have to take a whole month to verify stuff. Verification simple. Person give a name and identity card. You verify, say this is not the person. Where you go collect your money, you go with national ID card or whatever process where you take for go. Once they verify, they see you in person. And the information where you carry with the card, even at them party, so when you go pay for something, then they actually say, can I have an ID card? They look at your ID card and look at your face and say the name you supply and what's in an ID card match. Now, just that kind of system there. You don't go say power the health people and the frontline workers have to go to the office and verify. Get field staff. This field staff go to these hospitals, send communicate and say, okay, we are coming on Monday or we are coming on Friday, whatever they were applicable for verify staff then where they work. If you don't know, say me pay, if they don't verify me, I know they get me pay, they will not stay on you. So make it mandatory that since the staff then they come verify we on Friday, everybody have to be here. You get 4 days for let them verify. If you not get to pay, you are on your own. Then you go able, you the supervisor or manager, go able for identity come out plainly and say, so staff them will not get them paid now because they were not there to verify. So in the situation we are in, you have to wait for them for me then can office for can verify. And these people then they go work by the time they're off 5 o'clock, when they're off some man are applying in there. It's time consuming because they don't get enough time. So get field staff or finance staff or whoever staff where you get for do the verification. That's where the problem is, verification. Because then one lady people they can verify. And if there is an automated system, with system there in place, you can do it online. You don't even need for go to office or you don't even need for see somebody. You will just go online, you log on, you verify, you put your code, you put because everybody get their own unique code or personal information identification numbers. So the problem where they cause this delay, not to Ministry of Finance. When you look, they disburse cash. They already debit the account of Ministry of Finance. They already debit NACOVAC the account. NACOVAC is left with them to make the payments. That's where the bottleneck situation lies, because they can't verify on time. They do it like it's their own personal job. They're not doing this job like if they're doing a job for, then they serve people in a way their livelihood depend on them. So anytime you listen to them, oh, we're verifying, that's the flimsy excuse they're giving. And you know, go take a whole month to verify stuff. You understand? But again, that tends to be leadership. That's where leadership problem is. That's where, if I not say, there's a lack of leadership control. Because for me, being a manager, I dey follow to letter. I not even only send mail. I dey do follow up and call. If possible, I dey go back and try to verify. We've done it. Some of us made for after they work, me man. The first year when I send me a plan, the next year we win the most improved region. That's how you work. You need for be on top of your game. You need for verify. You need for follow up. You know, they sit down at your office, say, oh no, I need this information. Send me this information. Go on the ground. This is not the problem. You understand? I want to congratulate government because this is the first time we see people that we die during Ebola. There's still the language. There's still the ask question. We still hear so many. This is the first time. Kudos to the government. We want to congratulate them because it's a very good step. Because seeing them disbursing funds to people that we don't die, 6 people that will fall in heroes and we die, it's a good thing. It's a plus on their side. But we want to let them check the processes. They might be right in their processes, but the execution is very slow. That's where they need to lay emphasis. It's very, very slow because you got to remember, time and economic resource. You can't just be wasting people's time. These people are giving their best. They sacrifice their lives. You understand? Working at the front end, like working in the finance, getting information or data like the one the way they go find how you call them, where they go find people them, tracing officer or contact or whatever. Then they work so hard. Then about the areas them, they do so well, they work and getting them they on their own side. So for me, go back from them. But again, say there is a serious gap between NACOVAC and Ministry of Health. We've said that several times. When you therefore put a military person or a person when a non-health person ahead of the situation, these are the stuff because it creates a complacency because everybody they try for just work laggardly because they want to make you expose the weakness of the system. Because if this system was actually, I'm not going to say power by for being in that situation, handled by Ministry of Health, somebody when health personnel, it's easy because it's a language between the personnel heading it and the Ministry of Health. It's simple, it's like a flow, easy flow. But this NACOVAC, most of the people in NACOVAC, they are non-health workers. They are non-health, they have that background there. So it makes it different because it's like a different unit with different mindsets of people. All they know is they just come and do presentation. Oh, we get this, we get that, now this we get from this. So the Minister of Health aspects and other non-health workers, who are frontline workers, they left language. This is the problem we don't cause the delay. That's not my own take. Because lack of system, brother.
Thank you very much, Tony. Thank you, sir.
You're welcome.
Yeah. On the question we Tony asked, I think tomorrow we go get Dr. Aisatu, we go clarify more on that one day. I just give one of the reason them where George Kamabi provide for we about the cardiac complication. And Dr. Aisatu say there's more to that, but tomorrow, because we don't dwell now a lot, but by tomorrow we go get more from based on the question we Tony asked. Say a contest, say NACOVAC in the government, we don't know who that they talk to. He say some people need to know why they all two they play games with each other. He say and with citizens them, then they suffer. Yes, caller, they live on here. Your name and inside the call from, please.
Yeah, this is not Mike. I call from Philadelphia.
You got 3 minutes, Mike.
What they talk about this money, now the people actually they don't get this money, or now the insurance company then pay to this money. Now then we want to know.
Okay, the one we then pay to the next of kin, they pay directly to the family them. But the 7 billion, when at the insurance, then pay them to the insurance. We don't cover life insurance for them healthcare workers, them who they work directly with COVID-19 patients them till the end of 2021.
All right, but me, I don't want to just begin for Gladdy. I want to see I want to let one part of people and they don't pay, so let them verify so they then get the money, because salon when you come for money business, then get too much draw business, For pay them, then nurse and then doctor, then a big problem in a salon. It's either they get the money or they not get the money. Then they left for they play the game. The game, nine people they don't want. This promising, big talk. You need to stop, man. It's either you go do the job or you don't do the job. It's either you pay the money or you don't pay the money. When somebody owe you money, then get the money for pay you. They don't want to pay you. What thing are they call for? That means they don't want to pay you. They get the money, but they don't want to pay you. That means they're not ready for pay you. Let them come out and explain to the people and that one they say, look, we're not they pay now. People ain't gonna understand now one day. But this draw. Oh, they say they get 20 billion. These people they say they need for verify. It's all games, man. And then everywhere they lie too much, man. Too much promising. You know what this administration remind me of? It remind me of NPRC. Now that it just remind me just NPRC. It look like say everything is the same. You go put military man in charge of everything. Then they create all the problem. This just, I don't know, man. Salon, we need to change the way we lead at the mentality then the way they deal with we no fear at all, man. We as Leone, we are the open now. They went 2023. But they don't do a good job, they vote they out. I don't care what they do. Right now, they do nothing. They just they promise we. 2023, we'll vote them out. That's it. You know, I'm your contribution, Andy.
All right, thank you very much, Mike. Thank you, sir.
All right.
Judge Kamara say, for make we know, say, the money, they're not taxable. Yes, indeed, they're not taxable. Just like waiting the president self, don't say how the scheme go work. Make we call the scholar. Yes, scholar, they live on here. You name and side the call from?
Yes, my name is Abdullah Bimara. I call from France.
You get 3 minutes, sir.
Yes, me just want to make a quick one. You know, we all happy, you know, about waiting. They don't do. They don't pay the health workers. But we all know for say the health workers they deserve more. You know, for since when this coronavirus starts, we all don't see the other countries do how they kick up. We all don't see how the virus don't spread in the other countries. At least we all health workers they not be they receive money, but they still did their job. Then try. We all don't see say then 2 days when they cry for them payment. With the see case they rise in a salon. And when you not pay the health workers, that go affect it affects the health system. You see, because you know they wake up now money, they go risk your life for another man. We know they gain nothing. You see, this is not a good thing, but waiting at the only thing me want make them do more. You see, make them try again, make them organize more for the health workers. This not just the beginning. We all don't see Ebola time. So people they lost their life. Although that they not be last government or past government, all this kind of thing for donor salon. The government way they know now for take action for them thing then they. You see, people that they lose their life, but then can't see them. And the health workers at any time salon, we all see the kind disturbance that we really they happen. You know, they even talk when they do small thing for kind of social media for talk everything. Then people they deserve anything what they need forget. They deserve her and they work for her because they put their life before for me they protect the other people then. You see, that's a new contribution for this night.
All right, thank you very much, Abdullah. Thank you, sir. Yes, caller, they live on here. Your name and side the call from, please.
Yeah, this is I call from US.
You get 3 minutes, sir.
Yeah, I just want to give the government kudos for this payment we make to this next of kin. The question I want to ask is whether the people we wouldn't pay this money for the doctors, nurses, or who?
Now the doctors them. You know, so we don't lose one doctor we then call Samuel Cisse and another one the doctors them actually. The doctors them we lost their life and they get this life insurance money. And the other one will be Peter M. George. I think it was 3 or 4 of them where they don't pay their families them.
So that means the payment is gonna be very depending on the rank of the person involved.
Well, the one way we see, now the same amount they pay them.
But they're all doctors.
Yes, doctors.
Yeah, that's what I'm saying. So if and then unfortunately a nurse, it happens like a nurse dies.
Yes.
It's going to be different.
Yes.
They're not going to be different because of the pay scale. This one from Mike, I'm a man, you know, I like Mike, you know. If you don't believe, say, the people that get the money, it's always a lot, you know, you can do a small research, you know, you call people in a future, you know, I'm listening about we get people them around, you know, we understand the system. So you can go and friend the people and then you can ask them questions whether they receive the money or not, you know. Instead of spending and then calling for the people then for kind of verify, you know. You know, go do your research and check, you know, practicing the good thing and then government and do when they do good, you know, you praise them. If they fall short, you know, you talk them, you know, that's the way the system works, you know. You know, just condemn, blame all the time. When somebody do good, just like they picking also they begin they make mistake, they chastise them. But what you begin do well, you say you praise them, you get an extra diamond, like you can say. You get 2 diamonds instead of 1, you know. So you get a kudos, you know. That's my contribution.
Thank you very much, Ayo. Thank you, sir.
No problem.
Yes, caller, they're live on here. Your name and side call from, please.
Yes, Adama, I call from New York.
You get 3 minutes, Adama.
Okay, I just want one question I want to ask. I hear you say they don't pay some of the head workers. I just want to know if the money where they don't owe them, they pass money where they owe them, they promise them for say they give them. Is that part of it?
Okay. This one we will talk about so today. The finance minister don't say money day for that na system. Na the issue that's for the allowance system. But the salaries are being paid. Now the allowance system now then get question mark. But this one now the life insurance where government be promised. Life insurance where government be promised. Healthcare workers them say who that lost in life to COVID-19 and the one that would they work front line with COVID-19 patients them the kind benefits they wouldn't forget. Nine the government take care of so now.
Okay. No, I hear about that also. I was just curious. I just want to know if also then they're also not left behind, which is good. AAA, we all they come here and we they talk. And it's a good thing. And we already talk. Maybe someday it will stick. But my thing, we may not take out of politics in Sierra Leone, that until those two parties, they come together and really think for say, now for the people that want to work, things they not always go straight. Because one person, they say one thing, and somebody else says something. I mean, why can't they come together? Okay, if there's something they want for present to the public, okay, of the people of Sierra Leone, let them all get together and they talk. What you would, where and what you would say. Because sometimes it's really disgraceful, that they talk different things. Anyway, thank you very much. That's no what we can table today. Thank you.
All right, thank you very much, Adama. Thank you, ma'am.
Thank you.
Yeah. Yes, call ID live on your name and side call from, please.
This is Ranga call from UK.
You get the platform, 3 minutes, sir.
Oh, okay. Tripoli, thank you very much for bringing me on platform for today. First thing what I want to tell the government thank you, because at least this will and do so a very good thing is for let somebody lost in life on the fight against COVID-19, where everybody they stress everybody in the world now at this moment. So if the government bring this initiative and make sure say they execute them like they do and so for pay them people there, the next of king. So we have to respect the government and say thanks to the government, because we don't see the same similar thing that happened during the past government where Ebola been in a salon. Most of the health workers then died and lose them, their loved ones. Them the people who then left behind are the next of kin. Most of they see them, they perish in the country. They not get nobody who they look after them. So if this be done they happen, I believe say them people and they them for they live a better life as they did now, comparing the way they did right now, because most of they sit in the streets up and down and not get nobody who they look after them. So this will for say thanks to the government for bring this. This now the thing is who we talk at this forum. At least if the government do something very good, we get for applaud them for that. And this now one of the things where this present administration may say then a new direction. So now then think they have one for the sea. We don't want for the sea teach for that. Say, oh, where that government may do so together, so we say if we do so now. No, not like them think they want for sea. Let us bring example to the people of Sierra Leone for letting ensure and say, yes, this is a new direction. So we say thanks to the government to that. Again, me just a plea to them for the allowances the way they get for paid health workers there. Let them iron the differences between the administration. Let them make sure say them pay them people there, because they deserve more than as they think say not too much money this way them promise them people there. No, too much. If you don't see somebody, they get 1 million for a week, at least then for stand by their word. So let them pay them people that will make them steal. So I'm going to take this for tonight, and I thank them again for what they do, because this is now one of the things who we all pray God for. let them do the right thing. When they do the right thing, we praise them. If they do wrong, we get for hit on them back, show them, say, oh, with a point finger, say, this area, this is not right. So, for that matter, we say thanks to them. So now we will take this for tonight, Mr. Triple A. Thank you very much for giving me a platform.
Thank you, sir.
No problem.
Yeah.
Thank you.
Yes, caller, you're live on here. Your name and who the call from, please.
I'm Ibrahim, I call from Maryland.
You get 3 minutes, sir.
Thank you for giving me a platform. At the bottom, so what I don't see, like what you say on this platform, if the government do good work, we get for applaud them what they do. We not get for what they criticize all the time. If they do, like now small, but we get for appreciate because everybody, he lost his loved one, where he be say after God, now through that person, they will not survive, easy. But if the government been promised, say, the one they who don't lost their loved one, then through this fight, then they give them something to the next of kin, then we begin to see example. That's, we have to tell them plenty, thank you for that. But we hope say, where you don't start, then for continue. We not do on a specific people, no more than say, not only them why we get for do the other one, they will not care about them. We hope say, where you don't start the good work, so make them continue. Then the next one, the people where they put na the NACOVAC team, one of the people who head the team. And obviously, they get love for the health workers, they way in the risk their lives there, at the front line every day. If the president, right, he care about the health workers there, he get love for them, like what he don't start for do so, he get for try for change them people and they let he put somebody who na health care somebody. They don't look to party affiliation. Even if person no get no party where he belong to, if the person a healthcare worker, like a doctor, when they speak the same language with the fellow healthcare workers there, then we able to know them problems there. And then we able to know which side the problems and they, then we able to try for rectify them problems and they. But then guy there, then just get the kind of more for council don't give updates. When they ask, they even question themselves, they are taking one back. We be say now right for ask them question, and then give updates. Then they vex. If the man then get office, they also and they receive money from the consolidated fund. So I don't see no need why for put again now this team for this team. It don't make sense to me. I hope say the people who then say they give the money, no able verify, they able tell you say the money land at the arm. So now the contribution down. Thank you very much for giving the platform.
Thank you very much, Ibrahim. Thank you, sir.
Thank you. Welcome.
I think for now, we accept the government of Salone don't give the people their money. If not to so it be, trusts, Nayana Salone. Then people and then go come back. Can't tell we say, well, now be for just photo up now make them be good and then be big check, but they not receive the money. But for now, we not to so Ministry of Finance, the last time they tell we say they don't pay health workers them. Hey, 24 hours if health workers then come out, medical and dental association, then come out, then pull them press release say, they not paying nothing. Before Ministry of Finance can say it's a process. So for now, we agree say governments don't honor, it don't pay them. If governments not pay them, let them sit down. Government say them pay them, don't they not pay them? But me no say, Ayana Salone, if government not pay them, then go come out and say something. But for now, we agree say government of Sierra Leone promise them and they don't honor them. The 7 billion, we then say they don't pay through the national insurance scheme. Well, if the insurance company back, government not pay them, let them say government pay them. We don't say don't the road, we go here. But for now, we give the benefits of the one way they doubt. We agree say government is paid, government don't honor. But one thing we will not go forget, say the Minister of Finance, JJ Safasi, 80% of the money we then they spend inside the fight against COVID-19 in Salone, now government of Salone, their money. 80%. It's right now. with Colat, 20 billion, then a NACOVAC account. With Colato. Intel we say, even though that 20 billion they did, NACOVAC still they call for more money. Money, not a problem for this administration. That fact, we don't establish them. If not through borrowing, if not through giving, if not through taxation, if not through anything, but there is money. Money day. So, however, now for spender, now the problem. For the day on a day, how for spender, now the technicality, now the administrative issues, now they come in. You go say, now because we don't have system, because we forget system in place. This morning, statistics Sierra Leone be the 98.1. We don't send message to them. We just hope say them go answer the call. Make them canaya. Make who can ask them some of the questions them. Because August, yes, next month, go make 1 year where President Bill be launch the blockchain. Who will be say, now the first in Africa. What's in the happen with that registration day? What's in the happen? We have things them way they float around. We're able for address some of these systematic issues that will gain us alone. For one reason, we don't sabi why the thing that we for fix the issues here, they're not being taken care of. Because if now 1 year now, trust me, bro. 1 year, you want to tell me, say, they're not forbidden register a lot of people. Let them say now we'll begin with healthcare workers, we'll begin with the forces, we'll begin with this, we'll begin with that, we'll capture all of those people. Before that, then they tell me now, say, well, the last one will then be do the last census will then be do, na be paper based. But this one, na digital based, electronic based. So even the iPad, I mean, they say that 14 billion because every person we get for they out there for go count people them. You forget a tablet. We na get for use for count people and they say it's GPS based. So you know who can talk say they had to reach areas them. Then side them where you don't pass you, they actually say, "Boh, I pass. I get for campus here back. You know get for funny." Say sometimes somebody go just sit down and say, man, forget it. That village JSF, now they almost did it. Maybe not to them 14. Maybe I just put 16. They say now, when you reach the village, once you power the iPad or the tablets within the queue, as you power them on, it's GPS based. Then they know. Say yes, at this particular time you be there and you do what you're supposed to do. Then say if I agree saying at the first thing this, and way they can do this county for the census. But you go ask say, they don't tell you, they say December 4. Now that particular day, they take note. So I let them come to you December 15. The question then they ask you the 4th of December, how much people will sleep in this house? Year back, I like na December 15 then come to you. Then they ask you December 4. How many people sleep in this house? The blockchain, I go round and round back I come. The blockchain for able to address this issue. For able, where everybody has an identity, everybody gets number, like a social security number in the United States. Everybody has a number. We tied to a name. So when you go on site, it's digital. Where you say, now this, then pull them up, you name, you picture, you everything for come up. So when they want to verify, they just know the list. When the list come, then go to the system, then go there, then pull them up, and everybody, they then pay the money, so full. But 1 year, Tido, Joe, they drag foot no more. All thing now, the first in Africa. But whose benefits we don't get from them? Whose benefit? Is it the first time we're talking about this blockchain? No. And tomorrow, what our law discursive about them parliamentarian them. The parliamentarian them. You know, say Kuskas they inside C4C right now. Yes, C4C, then get Kuskas. You know, say Sa Emerson Lamina. Naina their own leader na parliament. They don't pull her. Sa Emerson Lamina back say, you know, degree. You know what you do? You know, say yesterday, then be vote. What in they vote for? For the commissioner for NEC. C4C split. Then split. Simon Lamina and I think 2 other people then vote in favor of the new NEC boss. Well, C4C not glad for that. Then we want to make them all vote against. So because of that, when at the head man, they don't pull and come out. He now say he no agree. He said because first of all, the person will write that letter, they address to parliament. He not get right for addresser. Not to even get right for write that letter day. So now he still team up day. The last term, Honorable Tawa. The other term, na be Mohamed Bangura. If we go back na the past administration, we they see. So who that then parliamentarian they represent na parliament? Are they there for their parties or then they for we the people of Sierra Leone? What do we feel? I think we need to talk about this because would they also be done they blame saying that then two political parties are SAPP and APC, SAPP and APC. Okay. Well now we don't see. Not the SAPP and APC this so. This is C4C. Coalition for change. For waiting for change. But in parliament, they want waiting they see. The parliamentarian, they not forget voice on their own for things say this is going to be right. Let me vote for this, or this is not right. Let me vote against this. The king go come back for come flag you. Where Honorable Tawa Bitawa that time. We see how the Deputy Minister of Internal Affairs, where they double as the spokesperson for the SLPP, we say an anti-party activity. And they can punish him for that. The same way Mame Bangua but one begin make like say, and they say, something I switch you want switch to SLPP. And then begin we then change para one day. When last year, yeah. You know say they in a parliament. Mame Bangua. You know say they when last year, yeah. After we then jaga and say if you see a mistake, and then put Andy there, they pull Andy. So then parliamentarian then now they are who that then they do for? And the political party. But remember, now the people and the vote. So until they blame the people of Sierra Leone, say then they vote on party lines, then they vote on this, then they vote on that. All thing. But look how the game they play right now. I think so it's just right. But if something else come, but I feel say we need to discuss this. But I think we don't discuss that in some way for Honorable Tawa the last time. In some way. But since C4C back, because before then they say, oh, they're two parties. My dear, C4C back don't toe the line. We don't know down the road if NGC back go on to that same line. We don't know. You don't see where they say something really for happen to the constitution and even to the political party then. But if the constitution of Sierra Leone bar political parties then for do such, Somebody can catch me, say, even right now, Tosule, inside the SLPP, concerning their own constitution, where then they try for sideline the one them, na the diaspora, make the whole position as alone. Yes? They don't write to PPRC. PPRC currently don't give the SLPP 5 days for correct the constitution. All the documents then are share a network table. We they watch them with one kind corner eye first. But trust me, we go for Kale and a table there. Then we political party then, that's alone. They were waiting now. They all be come out. They all them be formed yesterday. They all them be formed day before yesterday. They all, now the same language they talk here. For them people who they represent them at parliament. And for one reason, diaspora, we money, na they want. But your presence, pass it pleases the president. Now your presence go be felt. But without pleasing the president, forget that press release, it pleases the president of Sierra Leone, so and so person, for say, Tigipule, go be this person. You name, no go surface. So if you feel say, for go na ballot, or for go team up, for be flag bearer, or for be this person, for be parliamentarian, for be councillor, under, my dear, diaspora na money they want. You, presence, they don't want it. So if you get for please the president, you know say, you money get for bump. For make it pleases the president. For make you go all certain offices there. I'm not talking about this administration alone. I'm talking about the way we political party and building system na salon. For say, na like a secret society, if you mistake, you walk your foot small. You are out. Well, now the toss line don't begin so with Simon Silamina and C4C. They don't pull and they say you know to leader for the again. Simon Silamina say you know they agree. In the leader force. Waiting do because of the vote yesterday. If not be APC or if not be SLPP, then say then two party. Although some people then they say C4C, Uda Bona. Uda Bon C4C. If not be NGC, then they say but forget Uda Bon NGC. And they say third force, not the dinner salon. Because anybody will grab up there. If in mama no be APC, in papa go be SLPP. So I think it's just right. It's just right. Make we can talk small. But you, salon parliamentarian, the way how they want and they take themselves. What's the idea? Then fish after the president are there. All the powers. There you have parliamentarian, they tell you the kind of power we then get. You don't hear it? Okay. No, it's dynamic. They tell you the kind of power we then get. You know, go challenge them. But again, is it the good of the country? Because now the end, now they, all the laws them, they make. All the laws them. Now they then they make. Now the best we want for salon. If you ask just now that one go home. May all man go put in hand. They say Alusan and Alasan. Now they say Gbeshi. They say NGC na the Gbeshi. See for see now order. See for see back now. So they get two Gbeshi. Or they get two Gbeshi or it be say na so no more ide. Law just left and so. Because Alusane Alasan would have be given name the KKY. So even the last time they talk in the parliament, say it was Cheques, Honorable Chair Nomaju. He said, well, if all time NGC they call them Alusane Alasan, then they say then Abeshe. So who side they come out from? Because you can't get Beshe without Alusane Alasan. But we political party there. And then the problem na salon. We political party there. And then the problem. But when you look back, the people in a salon, they self not the problem. Because if somebody come out there just now, he say you want to go to this area, you want to go stand independently, they won't vote for him or her. They won't. They not go vote for her. As long as they not get that particular. I remember the time for the mayor now, Ivan Akisoya, where you go under SLPP, a lot of APC. But people at that time they say, wait till this woman go under APC. Why not go stand alone for don't go independent? People elect and for still vote for her. But you know why I go under them? Because independently you could team up Nas alone without a color. You're on your own, no. With people they know they see. So even though they say the political parties are a problem, we the people embark. Now we empower them political party. Because if we begin for help, say, you know what, hey, you don't do so much in this area. Now you will want. Then the person say, I don't even want to join them party. I want to stand for una. Don't then extra person there of they make you win. The political party then go begin negotiate with the candidates there. Yes, the one counts the win, make it there under them flag, but then the candidates go tell and say, me, waiting me go there for do now they go do. Then that clause, where then get where they should say, if they're not glad with parliamentarian where they represent in a parliament, they able pull and commodity. Eh? I don't say self na tomorrow while we'll talk this. I don't know why that will left hand for today. That will left hand for today. But we need for can talk this. I don't know. I will contact Saya Lamina. I don't know if he will agree for Cam. But I'll still contact him though. I don't want to talk about tomorrow. If he want Cam. It's fine. If you not come again, we're still going to talk. Because they're all safe. So I can't say, to be honest, all of us are Leone, we're not part of Salon problem. We need for change our mindset and be honest to ourselves, which is true. We don't talk about mindset in this program. At the same life no more. Nayana Salon. Those who begin today. Because if independently people then begin stand, Judge Kamara say too many red tapes there if somebody want stand independently. Well, I know. You have to feed the people them. You have to do this, you have to do that. Make them reach there now. All the money them be don't spend, you have to pull and force. But it is what it is. Diana Salon. We'll go there back tomorrow. Like I said, unless something else come, but I go really like for me we discuss parliamentarian them. Who that then they for? For we? Or for themselves? Or for them political party? Based on the line say, if waiting the party wants you for do, then the people they want you for do otherwise. If you do waiting the people they want, the party will change by you. Based on that, may God help we. No good time for talk. Now one grain salon we get. One. And we will do our best for make it be the kind salon where we want. Till we meet again tomorrow. Take policy. Tata.